Hello, everyone. My name is Esther M. I'm Program Manager at the National Committee on North Korea. On behalf of NCNK, thank you so much for joining us today for challenges and opportunities for public health engagement with North Korea in the COVID-19 era. We're pleased to host everyone today for this on the record discussion, and a recording of the session will be made available later on our YouTube channel. So if you'd like to see it again, please check that out. And without further ado, I'd like to turn it over to our Executive Director, Keith Luce, to introduce the program. Thank you.
Thanks, Esther, and welcome everyone. We're really pleased that you're with us today. On behalf of NCNK, it's our privilege today to host Joshua Pollack, editor of the Nonproliferation Review. He's a senior research associate at the James Martin Center for Nonproliferation Studies at the Middlebury Institute of International Studies, among many other responsibilities. We're also pleased to have joining Josh, Dr. Ferenc Dalnoki-Veress, scientist in residence and adjunct professor, James Martin Center for Nonproliferation Studies at the Middlebury Institute of International Studies. Following their presentations, we will then hear from Dr. Key Park, as someone who is not a stranger to those of you who are frequent attendees of NCNK programs. Dr. Park is director of the Korea Health Policy Project. He's a lecturer on global health and social medicine, Harvard Medical School. And again, each of these three individuals have an extensive background in so many, many other areas. We're really privileged to have them today. So now I'd like to turn over to Josh and to Ferenc for their presentation. Keep in mind, those of you in the audience, as they make remarks, feel free to comment questions through the Q&A function. So Josh, over to you.
Thank you very much, Esther and Keith, for hosting us today. And thank you, Dr. Park, for joining us. Of course, also thank you to the Korea Foundation for its sponsorship of our research on this subject. As Keith just mentioned, our report is titled, or rather Esther just mentioned, our report is titled Public Health Engagement with North Korea in the COVID-19 Era, Challenges and Opportunities. You can find the full report on the website of the James Martin Center for Nonproliferation Studies, which is www.nonproliferation.org. Easy to find. Now, Keith's introduction may have raised some questions in the minds of the audience. So before I discuss our report in any depth, I'd like to take a couple minutes to explain why two non-proliferation researchers are sitting before you today, virtually speaking, talking about, of all things, public health in North Korea. Now, there are certainly connections between public health and biodefense, but we're nuclear specialists, really. That's not what has brought us to this topic. So how did this happen? Well, we started thinking more about public health early in 2020, soon after the start of the pandemic. North Korea had activated a strict quarantine policy that was rapidly curtailing its ties with the outside world. And we thought cooperation in fighting the virus might be a way to establish a more constructive pattern of relations after the abrupt end of the three-sided diplomacy of the previous 2 years. The North Koreans even gave little hints around this time in their communications with Seoul and Washington that they maybe might be open to this sort of a conversation. But, of course, nothing came of that. The self-imposed closure has stayed in place. That reflects Pyongyang's understanding of the weakness of its health system and the vulnerability of its public to an epidemic. And if anything, the closure has become tighter with time. So, in the absence of immediate prospects for cooperation, why have we, non-proliferation specialists, inquired into the subject of engagement through public health? I see 4 reasons. Maybe there are more, but these are ours. First, humanitarian and nuclear issues have been connected in North Korea policy for a couple decades now. Energy assistance, of course, was part of the agreed framework in the 1990s. Many of us can remember the heavy fuel oil deliveries. Food aid, which in dollar terms represents most of the assistance provided by the United States to North Korea since 1995, was implicitly linked to the agreed framework and the 6-party talks. Food aid really ground to a halt when nuclear testing began in 2006 and then again in 2009. That really was the end of it. For the United States, these forms of engagement primarily concern North Korea's nuclear program. I'd say that it's been Washington's overriding concern about North Korea since the 90s. So there you have it. There's this long-standing connection. Second, non-proliferation sanctions that have been imposed since 2006 have complicated the delivery of aid. Bringing almost any goods into the country now requires prior approval, both from the United Nations 1718 Committee, which is named for the UN Security Council Resolution 1718 of 2006, and from the US Treasury. Third, and this perhaps is subtle, North Korea's self-imposed closure against the COVID-19 threat is doing more to stop the flow of goods in or out of the country than sanctions ever have. So it follows, if sanctions are to have any influence on Pyongyang's thinking, their self-imposed closure will have to end first. But until North Koreans have sufficient access to vaccines and healthcare, it's unlikely that the authorities in Pyongyang will be willing to open up again. And then there's the fourth point. Maybe this is the most important point of all. It's the idea we started with. We will never reach any understandings on any subject without the ability to talk and develop working relationships. That has to start somewhere, and fighting COVID is in everyone's shared interest today. If anything, this point now looms larger than it did at the outset of the pandemic when we started thinking about it. A consistent theme in the North Korean emergency response to COVID, consistent and perhaps underappreciated. Certainly I didn't get this until we started looking at this hard. It has been this: they fear that the virus could enter the country by any of a variety of pathways. And that includes on surfaces. Thus, both people and goods have been largely shut out. Until recently, this even included medical supplies. The reinforcement of the border, furthermore, has worked both ways. Not only are people and goods not coming in, they're really not going out. Very few people have been able to leave in the last 2 years with the enhancement of border security, new fences, new patrols, cameras. Furthermore, enhanced restrictions on internal movements within the country have reportedly made it harder to reach the border areas where Chinese cell phones can work. Recently, Andrei Lanko warned that North Korea is entering a new dark age as a consequence, with relatively little information getting in or out. So regardless of one's primary concerns in North Korea, whether it's humanitarian needs, human rights, nuclear disarmament, peace, unification, or anything else, a protracted shuttering of the country will not advance anyone's goals, quite the contrary. Just to be clear, we are not arguing for the abandonment of non-proliferation goals, but we do see a need for a better harmonization of how these goals are pursued with with the need to meet urgent humanitarian needs. Those needs are probably only growing more urgent. As the Washington Post's Michelle Lee reported a few weeks ago, there are indications that hunger in North Korea is becoming widespread as a result of the protracted closure. All the real data we have is now out of date. It's pre-pandemic, and the picture wasn't great even then. But earlier this year, Kim Jong-un even spoke openly of the possibility of another arduous march, referring to the famine of the 1990s. And more recently, he called the food situation tense. So the result is a vicious circle. Hunger, along with a poor water and sanitation situation and a hollowed out health system, has left the North Korean public especially vulnerable to disease. Thus, the North Koreans have enforced a strict closure to guard against the entry of the virus, which then makes these problems worse. So there's a Gordian knot, if you like. And how do we cut it? I think very simply, it will take outside help on a fairly large scale to get a large share of the public vaccinated and to restock North Korean health facilities which lack medicines, supplies, and equipment. The alternative to that is for North Korea to keep trying to wait out the pandemic with potentially grim consequences. Now, this will be hard. Trust is at a very low ebb. Pyongyang views American aid offers in particular as suspect. We've linked them in the past to our demands for disarmament, often implicitly, and during the Trump administration, explicitly. It was never entirely clear what President Trump and Secretary of State Pompeo meant when they said they would make North Korea wealthy. Presumably it's some kind of development aid or tax breaks for investment or something. But this was linked explicitly to demands for disarmament, which was a point the North Koreans kept rejecting, but Washington was not really listening. This July, an article appeared at the Foreign Ministry website that called American humanitarian assistance offers a sinister political scheme. So I'd say we are starting from very little trust at this point. Now, we reach in our report 3 major conclusions. I will give you the broad view of these, and then I'd like to hand it over to my colleague, Dr. Dalnoki-Veress, to give you more of the details. The first of the 3 points, reopening the borders will require a judgment by the authorities in Pyongyang that it is safe to proceed. In particular, they will need to be persuaded that launching a vaccination campaign will do more to prevent disease than to spread it. Remember, they fear that both people and goods could bring the virus in. So aid organizations may have to do some creative thinking about how best to convince the North Korean government of their ability to deliver a net positive outcome. Second, policymakers and aid organizations should find ways to streamline the existing humanitarian exemptions processes associated with sanctions. These are non-proliferation sanctions primarily, also human rights. In addition, it will be important to reestablish a stable banking channel so aid agency personnel can conduct routine transactions while they're in country. Third and last, but it looms large in my mind, if the United States is to play a meaningful role in this process, it must find a way to decouple its aid offers from its demands for North Korea's nuclear disarmament. Linking these issues has only hardened Pyongyang's suspicions about American intentions. And now I'll hand over to Ferenc to discuss all of these points in greater detail. Thank you.
So thank you, Josh. Thank you to NCNK for inviting us and allowing us to present the findings of our report. And thank you also to Dr. Key Park for agreeing to be a discussant. I feel really honored and grateful you take the time out of your schedule to be present here. Actually, I've been personally very impressed with your writings and your perspective, which challenges the prevailing narrative on North Korea. I especially appreciate your informed perspective on the state of healthcare in North Korea, which has serious problems, but also, as you emphasize, also strengths that are not often recognized. I'm deeply concerned that the success that has been had over the last few decades in terms of humanitarian aid will be seriously degraded because of the lockdown in North Korea, which, according to the UN panel of experts reports, has affected the financial bottom line of many organizations that actually operate and to be able to continue their work once the borders actually reopen. But it likely also affects the trust people have on the ground in North Korea of international organizations, as Josh mentioned. I see this venue today as what cultural theorist Homi Bhabha called a third space, kind of a safe space where different cultures and perspectives meet. It's in this spirit that we can meet from the nonproliferation side and humanitarian side and discuss issues of mutual interest. And in this case, the focus is on how to help the people of North Korea who are right now, I believe, in dire straits. I have a personal stake in this as well. My father-in-law was born in North Korea and has not seen his family since the end of the war. That's always in the back of my mind. Winter has always been difficult in North Korea with rampant food shortages. However, this year has been especially hard because of the closure of the borders since early 2020, even to China. Already before the pandemic, a 2020 assessment by the United Nations, I know this is not news to you, found that 40% of North Koreans need food and nutrition assistance. And according to UN, 1 in 5 kids are stunted. According to Rimjin Gang, an online publication that's based in Japan, there's even a severe shortage of rice for military use in North Korea, to the point that even commanders and their families struggle to secure rations. There are also reports that soldiers are stealing rations from farms. So the situation is likely quite bad. But we are now at a unique juncture. When the borders finally open and North Korean officials allow aid into the country, it's critical to have the conditions in place to be able to move as quickly as possible. That means dealing with lifting all the administrative and logistical hurdles that we often hear about to move as quickly as possible, which is something we can do and should do now. So I wanted to discuss some of the barriers to effective engagement which apply to public health, but also to other forms of humanitarian aid. The first is the unintended impact of sanctions. Since 2006, when the DPRK did its first nuclear test, the UN Security Council passed resolutions against North Korea's nuclear program and has harshly penalized the North Korean economy. The intent is to punish the regime, but not the North Korean people. Unfortunately, fuel import limitations have had knock-on effects, such as the hampering of the timely transport and processing of crops, and relying on less efficient methods of farming, and increased emphasis on manual farming, which has its own knock-on effects in terms of the health of the farmers and so on. So despite the intent to punish only the regime, the result has also led to confusion and a great deal of paperwork for different organizations, NGOs, intergovernmental organizations, and so on, to manage getting exemptions from the UNSC Resolution 1718, the DPRK Sanctions Committee, to allow resources to be transferred to North Korea without violating sanctions. Sanctions have also been imposed unilaterally, mainly from the United States, which has also had a significant influence on the humanitarian sector. In particular, the US NGOs must navigate the Office of Foreign Asset Control, or OFAC, and the Bureau of Industry and Security, or BIS, in order to get licenses to import materials into DPRK, plus the United Nations 1718 Sanctions Committee that I discussed. To be fair, the UN Sanctions Committee has been very transparent in publishing response times and surveying different NGOs and how they're dealing with the challenges brought on by the pandemic. and the complications brought on by sanctions. And actually, these response times have greatly improved from several years ago, when it would take 100 days to respond, and now it's more like 1 week or so. So that's a good improvement. However, the process could be further streamlined and simplified across the committee and parallel agencies in the US government. The other second point is the lack of a banking channel. And I know you've probably heard this before as well. On top of dealing with the UN and governmental agencies, UN agencies like UNICEF, WFP, and so on, must deal with the challenges of having no official banking channel to pay for services in North Korea. Especially since it also actually goes the other way, which is North Korea can't pay its dues, its UN dues, to be able to vote and so on. Especially since the DPRK's Foreign Trade Bank, officially financial channel in North Korea, has been under sanctions since 2013 by the US. And while the UN Security Council sanctioned the FTB since 2017, it's been a big problem. There used to be a kind of complicated 4-node banking channel where the UN agencies could transfer dollars to the German Commerzbank and then transfer the equivalent funds to the Sputnik Bank, which is a Russian bank, in rubles, which would then in turn deliver cash to the Foreign Trade Bank in North Korea, which is otherwise sanctioned. Unfortunately, the Commerzbank stopped participating in this channel in 2017, which has been complicating. And in November 2021, so just a month ago, the Sputnik Bank's license was revoked by the Russian government because of violations. So this gets to the significant problem of de-risking of banks, which is kind of a trend in this area. And it's not unique to DPRK at all, but it has very serious consequences really to the world. De-risking is a process where the banks decide that the risk of penalties for lending to what is perceived to be high-risk individuals or entities is not worth the financial risk for the banks to take. The fear is of the penalties that would result if transactions would lead to crimes and banks become liable. Now, banks have become spooked by the BNP Paribas settlement for $8.9 billion for sanctions violations in Sudan, Cuba, and Iran. And the result is that the banks don't trade with the DPRK. Even if items are exempt from sanctions, they're just too fearful of potential problems associated with that. Now, as there's actually no clear methodology for banks, and a lot of humanitarian agencies have complained about this, correspondent banks or NGOs to qualify the risk associated with the transaction. Furthermore, there's really no incentives for the banks to carry out the transactions, except to do so for the public good. The governments can't coerce banks to service NGO clients. Therefore, banks often use the most cautious practices possible, rather than applying a nuanced proportional approach to humanitarian organizations, causing really outright rejections or really very long delays in approvals. The same banks would block a transaction one day that would be approved a short time later, with no way of repealing the transaction. The result is that humanitarian organizations resort to much riskier behavior, delivering cash, which carries the physical risk of theft for humanitarians, delivering the funds, but is also much less transparent than a reliable banking channel. So to truly solve this problem, governments would have to share responsibility in developing thresholds of what constitutes a reason to deny service to an NGO or stop a transaction, and develop clear metrics for measuring the risk, rather than shifting responsibility to the banks and NGOs to kind of figure out what is an acceptable risk. And part of the problem is likely what the Honorable Sue Eckert, former Assistant Secretary of Commerce for Export Administration, argues is a lack of a common language between different organizations and different stakeholders. And that these communities are basically talking past each other, despite all stakeholders having similar goals and having parallel goals. So in other words, different stakeholders have not really put themselves into the shoes of others. And so in this kind of idea of a third space, a safe space to talk about this, one suggestion would be for different stakeholders, government officials, banks, export control officials, NGOs, UN officials, maybe border control officials and so on, to hold exercises where the roles are reversed so that they can learn from each other. And I'm going to come back to this issue a little bit later. The third point is kind of a white list of approved items for transfer without license. This is clearly badly needed and something that many people have mentioned many times, but there hasn't really been much movement on this. So, for example, Daniel Jasper of the American Friends Service Committee, AFSC, one of the first international NGOs resident in North Korea, described his frustration of trying to import plastic rice seedling trays, which is a non-sanctioned item, that can improve yield by as much as 10 to 20%. So can you imagine what the effect would be on North Korea if rice production can increase by something like 10%? He emphasized these items can't be shipped without a license, and it takes many months to get it. A whitelist of items for license exemptions that all US agencies, UN committees, banks, and customs officials approve should be in place. This is really a no-brainer, and I know this is not the first time that this has been proposed by people. So when you look at every crisis has kind of an opportunity, as people say. One possibility at this stage is to use new tools like blockchain to perhaps develop a secure whitelist. This is not without precedent. UNICEF Innovation Fund has funded 6 startups from Argentina, India, Tunisia, Mexico, and Bangladesh to apply blockchain to a variety of tasks in the purview of UNICEF. And the World Food Programme has funded Building Blocks, which was the largest use of blockchain technology for humanitarian relief in globally assisting 1 million people in Bangladesh and Jordan. So there's precedent to this. And it's a matter of people, actually focusing on this particular issue. Bank de-risking as it affects NGOs is my 4th point. To address the bank de-risking and rejection of NGOs, again, a secure list should be prepared of all employees and staff of NGOs so that banks can have an informed opinions about opening accounts with NGOs rather than depending on the media organization like Thomson Reuters, which may mention them in a negative way and then lead to possibly a rejection. One intermediate approach to solving the bank de-risking issue to create a whitelist of NGOs and employees that all stakeholders can agree to is legitimate and consult when a transaction of humanitarian aid is requested or humanitarians travel to DPRK. For example, the organization NGO Source of TechSoup Global and the Council of Foundations runs a fee-based database of foreign NGOs that US grant makers use to evaluate whether intended foreign grantee, like a foreign NGO, is equivalent to a US public charity. It's called equivalency determination for the IRS. Another similar organization is SWIFT's Know Your Customers or KYC database, which is also a fee-based system to conduct due diligence in a cost-effective, systematic way. Maybe a combination of NGO Source and SWIFT could be developed to allow stakeholders to determine the risk profile of NGOs and for items to be delivered. The World Bank suggests that NGOs could submit a dedicated questionnaire tailored for NGOs, which are now basically used for correspondent banks by other banks, perhaps modified for humanitarian organizations. The 3rd point I wanted to point out is demonstration to DPRK officials. This gets at what Josh was talking about, that NGOs and different organizations are taking the COVID-19 threat very seriously. And this is based on something that Dr. Park has suggested. It's not clear when Pyongyang will finally reopen. To encourage this decision to come sooner rather than later, humanitarian organizations to be prepared to demonstrate to North Korean officials how seriously they take the COVID-19 threat. Dr. Park proposed that a pilot team should be ready to prove that they're free of COVID-19 infections by showing antibody tests and not just vaccine certificates, which authorities may not trust. To support this and to indicate to North Korea that humanitarian organizations understand and share North Korea's concern with the pandemic, maybe well-documented simulations for North Korea could be done, or tabletop exercises could be planned to demonstrate the type of precautions humanitarian organizations are taking that plan to travel and be resident in North Korea. The last point is the same one as Josh pointed out, which is, again, no-brainer, decouple humanitarian aid to North Korea from sanctions or any policy decisions targeted at the regime. We're talking about 2 different things. The people in North Korea and the regime. So it's likely that the departure of the Swiss Global Fund from providing grants to North Korea for TB and malaria control in 2018 may have been for political reasons. The organization resumed its support in January 2020, This does not foster trust in humanitarian organizations in the future. It's not known what the effect was of the Global Fund leaving North Korea. And we don't have proof that the Global Fund left North Korea for political reasons, but the interference of politics in humanitarian assistance should not occur. It seems to be a tall ask, but provisions need to be in place so that humanitarian organizations and funding, maybe governmental statements, I don't know, should never be used as political instruments. I think I'll leave it there.
Ferenc, thanks so much for your presentation. We'll now turn to Key Park for your response and your thoughts in general.
Thanks, Keith. And once again, I appreciate you and Esther for organizing this webinar, although it's very close to the holidays. But thank you for doing that. And just want to say to Joshua and Ferenc, the report was outstanding. I've always resented the fact that people who work on North Korea issues, especially health workers like myself, we're the ones who had to learn about the security dimensions of North Korea and overall geopolitics to better understand the whole context and how health is impacted by things that are not immediately obvious. But so I've always said, why should I have to be the one that studies about security issues? They should study about health issues. And here we have two non-proliferation experts, particle physicists. You guys have read a lot. So thank you for making me feel a lot better. And then the fact that, so all kidding aside, the conclusions you've made from your own independent research are so much in line with sort of the conclusions that we've made. Now, I work in global health. So there's an assumption that, of course, Dr. Park's going to say, principled humanitarian engagement, health engagement, all that stuff is sort of given. But to have it come from people like, Middlebury, you guys, that is just pure gold. Right? So thank you, because it brings a whole nother level of seriousness to the recommendations. And so thank you for doing that. So I do have some comments about the report itself and some questions that I want to delve a little bit deeper into. And you really shined a light about the link between policy objectives, the politics, the security interests of certain governments, and how they are linked to humanitarian aid. So we saw this happen. You outlined it beautifully, but some examples that I saw was just during the summitry where Pompeo went to North Pyongyang, things didn't go very well, as you know. This was in, I think, 2018. This is a window where U.S. had instituted a travel ban for all U.S. citizens, left a small window for humanitarian workers to get exemption and get a special validation passports. And many organizations had been able to go to Pyongyang, including our group, with a special validation passport. He comes back from Pyongyang and says, shut everything down because things didn't go very well. The next time, none of the organizations are getting their passports. And it was clearly that the US government was using humanitarian aid workers as a lever of pressure. So you made this point, Joshua, very nicely. First of all, it's immoral, okay? Yeah. Everybody, all professionals know humanitarian aid should be delivered based on only need, and it should be impartial and neutral, never be tied to political objectives. So it's immoral. The second thing is, and you alluded to this, it doesn't really work very well. It's just a minimal amount of pressure. I don't even think it makes any difference from North Korea's calculus that, they shut down the humanitarian aid workers to coming to Pyongyang. So I really like that. So the question I have is, and I agree with you, that the point that you made is, what are some things you think the US can do now that demonstrates their delinking, if they wanted to demonstrate that, delinking of their security objectives from humanitarian aid? So that's one question. And then the other question is, I have to Ferenc, because you brought up this important issue of using blockchain technology as really a way to monitor endpoint distribution to the intended targets. I think it's worked very well for certain UN agencies. But the question is a little bit more to have to do with dual use. Is there any risk of introducing blockchain technology for monitoring for humanitarian aid delivery and then using that, that could be used for hacking, for instance. So I'll stop there.
Josh?
Yeah, well, I mean, you've asked a hard question on how do we convey convincingly that we're not linking these two things. I don't have a complete answer to that question. And I will confess, despite what you and Ferenc have said about the morality, or rather immorality, of the instrumentalization of aid, I will confess to a little ambivalence on the subject. When I look at the record of US North Korean dealings since the agreed framework, I can see that in the periods when there was large scale aid, we did not see nuclear testing. And, you know, correlation isn't causation, of course. And so one wants to be cautious about that. What I think mainly about these linkages is A, it's been capricious and it hasn't been transparent. And B, it has been aiming too high. We cannot demand the disarmament of North Korea on the strength of heavy fuel oil or food or medicine or anything like that, because this is too close to the regime's core concerns. They're not going to do it. So it is too weak a read. So just on pure effectiveness grounds, I think we are defeating whatever is good about humanitarian aid. We are defeating that by linking it to our full set of goals. Could I be persuaded that some linkage might be possible to some other goal? Maybe. Like I say, I'm conflicted about it. I'm ambivalent. But certainly not for disarmament demands. So okay. So how do we put some distance between humanitarian aid and disarmament demands? I think the answer, in part, is don't make this an American-only show. That's one thing. You know, involve others, like China. Obviously, they have to be involved. Who have not made disarmament their top singular priority, but see it as a part of a constellation of issues on North Korea. Without abandoning our goals or weakening our stance on compliance with Security Council resolutions, we should be willing to put that in a separate track where different officials are going to talk about that. And they're not going to talk about aid. I think that would be a helpful way to just, you know, other than at the presidential level or perhaps the Secretary of State level, separate the tracks. Maybe even at the Secretary of State level. I think just anything you can do to send a signal that these two things are not going to be connected. Obviously, we have an issue in the United States, which is the separation of powers. And even if the executive branch decides on this approach, other concerns are going to be expressed by the legislative branch. And we saw this with, for example, implementation of the agreed framework. Congress would want to put its 2 cents in, and that affected how aid was or wasn't delivered. So it may be hard, ultimately, to give an airtight assurance that there will be no connections, especially when Congress controls the purse strings. And Congress is going to reflect a lot of different concerns, and they may be willing to make linkages even where the executive branch might understand the importance of keeping them apart. So I'd say one possibility also is trying to involve congressional leadership in communicating our intention to keep these tracks separate. I don't know what that would take exactly, but I do think it might help. I don't know that the North Koreans have that nuanced an understanding of our internal political dynamics, but they've seen it enough that I would think it would help to bring that voice into the conversation as well.
Right. Thank you, Josh. And a key in a moment. Why don't you restate the question for Ferenc? And Ferenc, before you respond, just a reminder to our audience that if you have questions, please submit them through the Q&A function. So Key, restate your question if you would.
Yeah, hi, Ferenc. The question I had was about use of blockchain technology. You had suggested that, and it's been used successfully in development, and whether or not that represents a risk from a dual use standpoint in North Korea.
Yeah, I knew that would pique people's interest. And Josh and I discussed, should we mention this or should we not? I understand that blockchain itself has very kind of negative reputation in terms of cryptocurrencies, and North Korea has not been the best or has been the worst when it comes to abusing cryptocurrencies. There was the $100 million that they stole in between 2017 and 2020. But this here, we're talking about something I would say quite different, which is using distributed ledgers to make sure that, you know, different products or resources or whatever it is, different aid gets to the right source and the right location in a way that's more difficult to hack. So this is not giving some new technology to North Korea that could be used for dual use purposes. It is not, for example, which is something I was bordering on thinking about talking about, is using a potentially, you know, a crypto channel or something instead of banking. So peer-to-peer, directly from the United Nations, directly to some financial organization in the DPRK that's not sanctioned. And that, you know, I'm not talking about that. I'm talking about something quite different. And that is how I understand also the way it works in these different organizations in the United Nations is not so much for payment as for, well, it's for payment, but for verifying the payment. It's not using cryptocurrencies. So I think the dual use threat is much less. So I'm less concerned about that than I would be about a crypto channel in terms of currency.
Key, any other comments at this point?
No, over to you, Keith.
So I'd like to pause for a moment related to the presentations from Josh and Ferenc. And Key, I actually have a question for you. You may have noticed in today's NK News, there's a headline that Red Cross allocates $1.2 million to help North Korea combat COVID-19. Now, once we get into the article, it points out that, and I'm quoting, the IFRC, International Federation, or the International Red Cross Federation, has spent nearly $760,000 US as of September, this September, since January 31 of last year, to support anti-pandemic activities in North Korea, with the largest portion spent on health-related operations. The article goes on to say, quote, the report also says that some 134,000 Red Cross volunteers have been mobilized across the country in support of anti-epidemic activities, including awareness raising, surveillance, and screening of the community. The Red Cross has educated around 10,000 volunteers who worked closely with health professionals about COVID-19 preventive measures. And then finally, toward the end of the article, and I'm quoting, the IFRC received a sanctions exemption from the UN at the start of the pandemic to send one RT-PCR diagnostic machine, 10,000 test kits, 10,000 pairs of exam gloves, 4,000 surgical masks, and 200 medical gowns to the north. among other items. Now, Dr. Park, you're the medical professional here. I'm not, but help me connect the dots. It seems to me that according to this report, I mean, if we're talking about screening, does screening not involve testing?
That's a good question.
That's my first question. What could encompass screening?
Yeah, I saw that as well. So North Korea's testing protocol is based on symptoms and contacts with people who have had contacts with potential infected material. So let's say someone works at the border control, then they contact with other people, then, let's say they broke quarantine, and then all the contacts would have to go into quarantine. I think it might be those kinds of activities that they're pointing towards. So yeah, I without additional information, it's hard to say what screening entails, but they do monitor the population for anyone with respiratory symptoms. But I think that would be more in line with the section doctors and health systems rather than the Red Cross volunteers. But once again, I don't know the details how North Korea implements their surveillance system.
So would it be erroneous for me to consider the possibility that IFRC has in fact been able to get equipment into the country for anti-COVID efforts?
I think they did. I'm sure the supplies have arrived. There was a delay early on, but then during the summertime, there was a bunch of cargo that let in. Just so there's a background information, the DPRK Ministry of Public Health, with the help of WHO, developed a national COVID prevention and response plan. And that included surveillance, medical facilities, and then also continuous provision of basic medical services. But that was about $34 million budget for that entire the plan to be implemented. So I'm sure that the IFRC, so within that plan, there were, I think, 20 machines, the COVID testing machines that were included in that package. So it's possible that additional machines were delivered. In fact, it looks like they were delivered, because if you look at North Korea's testing rates, they have steadily increased over the pandemic.
All right, Josh, do you have a quick additional point before we move on?
No. I don't at this point.
All right. Jenny Town poses the question, and this would be for Josh or Ferenc. North Korea has shown interest in increasing their own vaccine production capabilities to become, over time, less dependent on the international community to handle crises like this. The international community has been largely against it because of the potential for dual use of manufacturing facilities. Is this concern valid or overstated? Josh?
Well, that's a good question. I think it's hard to know without understanding the specifics of what sort of facilities and technologies would be involved. There certainly have been issues of this sort in the past, so I don't mean to be dismissive. The most prominent example that stands out in my mind arose in the summer of 2015, when the North Koreans exhibited a facility for the production of bacteria that could be fed to livestock to kill off infectious organisms, or could be sprayed on crops to kill off moths and butterflies that might be eating cabbage, say. And this technology could also be put to use to produce anthrax if they were so inclined. And they had learned how to produce it. They learned the production techniques through an NGO funded by the Swiss aid agency. So that was a little disconcerting, and it points up the real risks involved in dual-use technologies in the biospace. But when it comes to vaccine development, I just have not seen the specifics that would say, yes, that technology is a concern, and no, that one is okay. And I think until we know exactly what is being sought, it's hard to answer in the abstract.
Okay.
But I do want to say that the concerns at the highest level of abstraction are real. They are genuine, and so I wouldn't shrug this off in general as say a punitive attitude. But the details matter, and you don't want a legitimate concern in the abstract to get in the way of a specific pursuit that might be viable.
All right. We now have a question from Ethan Jewell with NK News and NK Pro. This is a question for both Josh and Ferenc. What's the potential for antiviral pills, such as Pfizer's Paxlovid, to sway officials in Pyongyang to open the border? Would Pyongyang import the pills or try to manufacture them, assuming they have the technology to do so? And then for Dr. Park, Ethan asks if you've ever encountered any skepticism from DPRK health officials toward outside medical help. So Josh, first to you, then to Ferenc, and then to Key.
I'll defer to Ferenc.
Well, I will defer to Key, except to say that Ethan and all the journalists at NK News and NK Pro have really done a really good effort to try to follow what's going on in North Korea in terms of the humanitarian issues and so on. So I really appreciate that. But this question, I'm going to pivot to Dr. Park, if you don't mind. So the question is about the potential of antiviral pills maybe helping to convince humanitarian organizations.
Sure.
Yeah.
Sure. No, happy to take that. So the medical countermeasures, these antiviral therapeutics, these could be a game changer. The main reason is because they reduce the risk of these illnesses to basically a common cold, right? The mortality goes down dramatically. It's manageable, especially in a sort of a low resource health system like North Korea's. And the best part is that these treatments are, they could be stored. They're just pills. They could be stored in regular warehouses. The problem here is that, like everything that's happened in this pandemic with the vaccine, these are commercially developed products, and there's going to be a battle between making profit and then providing an equitable distribution of these medicines to all who need it. And so that remains to be seen how how that plays out. But that'd be my number one concern: distribution aspects.
All right. So Key, would you like to go ahead and tackle the question from Ethan Jewell? He's interested in knowing if you've ever encountered skepticism from DPRK health officials toward outside medical help.
So I'm not sure what he means by skepticism, whether or not we're seen as security threats or whether our qualifications are looked at as, not so our credentials are not good. So from a professional standpoint, North Korea has a lot of faith in what I would consider Western medicine. They have a lot of faith in Eastern medicine. Korean medicine is a very robust part of their health system, but at the same time, they recognize the curative, and the treatment effectiveness of modern Western medicine. And they have, their medical libraries are full of it. They have sent their physicians and surgeons to overseas for training and brought them back. So so when we go there, we are seen as people who are, knowledge bearers of the latest and the best information.
All right. For Key Park, we have a question from Charles Sands. And Key, you may want to clarify. I think the gist of Charlie Sands' questions is something you may want to clarify from what you earlier stated. Charles Sands says, Dr. Park, you said that when Secretary Pompeo returned from Pyongyang, he canceled all OFAC special licenses for humanitarian workers in the North. What part did the fact that North Korea had detained Americans, et cetera, was that part of his decision-making process?
So I know Charlie. He and I have worked together, and he's part of the Pyongyang University of Science and Technology. So to answer this question, what happened is that there was beginning of symmetry between Pompeo and from Kim Jong-un and Donald Trump. It started with Singapore prior to, and then there was a release of 3 detained Korean Americans they came back to stateside. So there were no more detainees. Then Americans were going in with humanitarian special validation passports. And then that stopped immediately after Pompeo returned from Pyongyang, where his negotiations with North Korean officials didn't go quite well. So I don't think at that point it was a concern of being detained. That's why he said all of a sudden, because that travel ban was already in place.
All right, Josh or Ferenc, do you have any responses to Key's earlier statement in response to the question from Ethan Jewell from NK News and Pro? If not, that's fine.
No, I don't. I think this is one area where no amount of reading is going to bring you up to speed. And it's really about firsthand experience. All
right. So now I'd like to pivot to the report, and I'm going to read an excerpt from the report. And I'm quoting, the severity of the self-imposed blockade has created the impression that some in Pyongyang may even see the protracted emergency as an opportunity to reassert ideological control over the population after decades of increasingly tolerated market activities. Condemnations of market activity in the guise of anti-socialist and non-socialist practices began to appear frequently in the official media since around December 2019, even before the start of the pandemic, and continue to appear, end of quote, in October 2021. Kim Jong-un gave a speech calling for the strengthening of ideological purity and the party's guidance over administrative and economic work, end of quote. So as I read this part of the report, it seems to be that you're suggesting that the authorities in Pyongyang, the authorities to be, are using the quarantine, the continued quarantine crackdown as a means to squelch market activities. I'd like you to sort of square that with our knowing, as you know, that when Kim Jong-un took over as leader, he started shifting from military first to the economy, to economy first, quite an emphasis there. As you know, he has allowed the training of over 3,000 entrepreneurs by Chosen Exchange out of Singapore. In fact, when the October of this year's speech that you reference, that very month, Kim Jong-un had allowed the training, more training, a virtual training seminar of North Koreans by Chosen Exchange on how to make money, how to start business, etc. And we know from a variety of other sources that Kim Jong-un really has interest in growing the country's economy for many reasons, which are obvious. So my question to you is, when I read your assertion, and I also know about Kim Jong-un's emphasis on the economy, reforming the economy, even though he would not use that word, are you suggesting that perhaps there is power in Pyongyang away from Kim Jong-un that is having a greater influence in this decision-making process? Now, indeed, the weather conditions, the pandemic did force a reconsideration of control of the economy overall. I acknowledge that, but could you please elaborate on your assertion that the lockdown is in part due to an effort to squelch market activities?
Well, I don't know that I would say it is caused by a desire to squelch market activities. I see the connection, if there is one, is more opportunistic. Now, trying to parse internal North Korean politics, I have found, is a mug's game. But when it comes to Kim Jong-un's perspectives, we should at least consider the possibility that he may be of more than one mind on subjects, and that circumstances do change. I think, yes, in general, I agree with your take on Kim's attitude towards market activities. although market activity can never be acknowledged by the regime in a public way as legitimate, they find ways of talking around the subject and of enabling market activity. I think that an important lesson for Kim when he came into power was the failure of the 2008 currency reform, which in part was an attempt to seize the savings of entrepreneurs. It did not go well. And after that, Kim decided not to repeat the mistakes associated with that campaign. So where I see the change as having taken place is with the Hanoi summit in February of 2019. At this point, Kim recognized he was not going to get sanctions relief. It was not in the offing. So his ambitions for developing the economy, which he voiced quite openly in 2018, especially, were going to have to take a back seat. And he expressed concerns at that time that the youth, the North Korean youth, maybe were too soft, that they didn't know what it was like to undergo hardship. And you might remember when he went up Mount Paektu on a white horse, and he's basically telling North Koreans that they were going to have to deal with some hard times for a while. And that's all before the pandemic. You remember the rhetoric of, a frontal breakthrough through all the difficulties. So there definitely was a sense after Hanoi that the authorities were reducing their ambitions for near-term economic progress, and maybe pulling their limbs back into the turtle shell a bit, if you like. So already there was, I think, a desire to focus more on problems of ideological poisoning that are a consequence of expanded trade and expanded exposure to outside information, and less of an immediate focus on developing opportunities for economic growth. So I think that this may be a case of making lemonade out of lemons. Well, if you cannot trade, if you must control the borders, then let's take the occasion to try to squelch external influences and to reverse some of the damage that we've experienced in terms of the attitudes and orientation of the younger generation, this sort of marketized generation. So I see it as opportunistic and not as part of a plan. But I also see it as creating, for whatever it's worth, some kind of constituency within the regime for a continuation of the lockdown and for greater caution. And that's speculative, I will admit. And I don't. And when you say that this is asserted, I understand what you're saying. It would be very hard to demonstrate this. But I think that this is just something we should bear in mind. This will not be easy to persuade the regime to reopen. You've got to ask, why do they care about public health when it's very clear that they will let a lot of the country go hungry to meet their wider objectives? And I think there's a balance that they have to observe between ideological control and privation. They don't want ideological control to break down, but they also don't want, they want to continue to appear to be providing basic services to the public at some level to maintain their legitimacy. And they have to balance these considerations, and we should simply be mindful of that.
Okay, Ferenc, any comments on your part? All right. Before I turn back to Josh and Ferenc for any final remarks before we conclude the meeting, I have a question for Key. And Key, I've heard you discuss this in the past. I'd like you to elaborate, if you could, please. What is the potential of North Korea related to producing its own vaccine and/or antiviral pills?
That's a great question. I had to push back away from I have this glare. Can you hear me okay?
Yes, yes.
Great. So a couple of things. North Korea has capabilities of manufacturing developing and manufacturing vaccines, and they have done that in the past. But not all vaccines are alike. So you've got vaccines that are very simple, which are live attenuated viruses, to killed viruses to inactivate them, to protein molecules, all the way to these DNA particles, RNA particles that are encapsulated. So I think the real question here is that people are talking about is the mRNA technology, which is the new next level cutting edge technology. So I want to just go back to the question you had about, I think it was Jenny Towns who asked, is this the threat of having this kind of technology, is that overplayed? Absolutely. Not everything North Korea does should be seen in the frame of, can it be used to threaten other people? No, they want to develop vaccines, and they have much simpler, cheaper, and more deadlier ways of killing people than trying to use mRNA particles packaged up in a very, very complicated nanoparticle, capsules that are highly unstable, and you require, so if you're a person who's trying to destroy a city, that's not the way to do it, right? Carry your own little freezer. You don't know, so it makes no sense to me. I think it's definitely overplayed. Same thing with the manufacturing capabilities for pharmaceuticals. They have it. They used to have a joint venture with a Swiss pharmaceutical company, Pyeongso Pharmaceuticals. They can do it. The key is ingredients and then the formulation. I don't think they would have the proprietary information to manufacture, for instance, the new drugs. And even if they were able to get it, they would have to perform bioassays to make sure that it is doing what it's supposed to do. So I'm not sure if they're this idea that they can manufacture their own antivirals. It would have to be in conjunction with probably the manufacturer, the patent holders, or if they release the patents, other companies that are manufacturing it currently.
All right, thanks, Key. And before I turn to Josh and Ferenc, I'd like to point out that John Hart in the Q&A function has offered a link to work on the DPRK economy by Dr. Rüdiger Frank, which he's a tremendous resource. So Josh, closing comments. And by the way, Josh,
yes,
after the report was published, what was it that you said to yourself, I wish we would have included what?
Well, I think in part, some of Ferenc's discussions that we've had earlier today concerning blockchain mechanisms that are not cryptocurrency, that did not find its way into the final report, because this is a novel area for us. And I think we felt we were pushing the envelope enough on our own knowledge base that we might want to avoid pushing in particular directions on how a particular recommendation would be advanced. There are a lot of considerations and a lot of stakeholders. I really think the next step, I think, first of all, these ideas did deserve an airing, and I'm glad Ferenc raised them in the presentation today. But second, I think for a fuller appreciation of the issues, what we really need to do is what is a different point that Ferenc raised, which is to find a mechanism to bring the stakeholders together. I don't know if it has to be a game or role reversal or anything like that, but we need to bring people from different domains, from banking, from State Department, from just from a variety of different areas, from the aid agencies, obviously, into one room, virtual or otherwise, to get some of these issues on the table if we're going to see any progress.
All right, now, thank you.
Ferenc?
Well, I completely agree with what Josh is saying. It's basically what I wanted to say. I guess that the main point for me is really we have no time to lose right now. It's really, we don't know when the regime will open up again, and we have now a time for we have to plan so that immediately we can move forward.
Key Park, final comments?
Yeah, there's one thing that I learned from this type of webinar is when you have, a surgeon or public health specialist, non-proliferation specialist, and a particle scientist, hosted by a Hill staffer, professional. This is the kind of webinars that we need more of, because you need to bring different disciplines together, because this is the only way we're going to come up with a creative solution to North Korea problem. I just wanted to thank Korea Foundation for sponsoring your project. I just want to say thank you to Korea Foundation, because they're the ones that actually support our Korea Health Policy project. And a lot of the documents that you've referenced was directly a result of their support. So thank you all.
Keith, yes, Josh?
If I can throw in one last thought. A lot of what we've discussed today is about ways that nonproliferation policy is wrong-footing humanitarian aid delivery. But I think it's equally important now to see that it's the other way around, that the closure that the North Koreans have imposed upon themselves as a result of a lack of an adequate health system to contend with the epidemic is in the end going to frustrate our other objectives, including nonproliferation, simply because we cannot talk to them. We cannot impose meaningful consequences on them compared to what they're doing to themselves. We should see this not as, say, collateral damage of sanctions anymore, but we should see humanitarian aid and vaccine delivery and the other issues we've been discussing as an enabler, a way of getting through current difficulties and returning to neglected issues that include our nonproliferation objectives.
Well, Josh and Ferenc, thank you for a tremendous presentation today. Key, as always, your input was extremely helpful. On behalf of Esther M. and myself, I'd like to thank the audience for attending, and everyone enjoy the holidays. Goodbye.
Bye.